What if I told you that you could dramatically improve your gum health starting today without spending a single cent? Well, in this explainer, we're going to focus on the powerful at-home techniques that can make a huge difference, probably more than you'd even think is possible. So let's just dive right in with the big question. Can you actually reverse gum disease for free? I know, it sounds a little too good to be true, right? But stick with me, because we're about to break down how the most powerful changes you can make cost you absolutely nothing. Okay, let's get into it. The secret isn't some fancy high-tech gadget or an expensive new procedure. Believe it or not, the most effective tools you need are probably already sitting in your bathroom right this second. We're talking about simple back-to-basics techniques that, when you do them right, change everything. Now, to be super clear about what really gets results, let's quickly cover what we're not going to be talking about. We're not talking about oil pulling. The science just isn't there. We're also going to skip most of those special mouthwashes. Yeah, they freshen your breath, but their actual clinical use is pretty limited. And while things like air or water flossers have a place, they can be pricey, and our whole focus here is on the free stuff that delivers the biggest impact. And that brings us right to the core idea of this whole explainer: getting the biggest bang for your buck. Or, in this case, the biggest bang for, well, no buck at all. Let's really understand where the most significant improvements in your gum health are going to come from. Now, this slide is fascinating because it paints such a clear picture. What you're looking at is the level of gum disease versus the cost of dealing with it. And just look at that first bar. The single most dramatic drop in gum disease comes from proper at-home brushing, which is free. Now, compare that to a professional cleaning or even specialist surgery. They absolutely help, but you can see the improvement is more gradual. The key takeaway here is that when you master the free stuff, it makes everything else that follows way, way more effective. And this just hammers that point home. The single biggest leap forward you can possibly make for your gums comes from these simple, free techniques. It's a really empowering idea, isn't it? The power is literally in your hands. So, if it's that simple, why do so many of us still struggle? Well, the answer usually isn't about how often you're brushing. It's all about how well you're actually doing it. You know, dentists often see people fall into one of two camps. First, you've got the lost hope group. Things have gotten to a point where they just think, what's the point anymore? So they barely brush. Then you've got the second group, the frequent, ineffective brusher. This is the person who brushes 2, maybe even 3 times a day, but the problem just doesn't go away. Why? Because the technique is completely missing the mark. Do you maybe see yourself in one of these groups? Now, this slide makes a really important point, but it uses an extreme example. So please, we are not recommending you only brush every 2 days. But the idea is that effectiveness is so much more important than frequency. One really great targeted cleaning is infinitely better than dozens of sloppy, ineffective ones. Okay, so let's get practical. Let's talk about the foundational brushing technique. And you really don't need a fancy electric toothbrush for this. You can get an absolutely fantastic clean with a simple manual brush. Heck, even a free one from a hotel, as long as you use it the right way. Here are the 4 steps to master. First, and this one is absolutely crucial, angle your bristles to 45 degrees. You want to aim them into the gum line, right where the tooth meets the gum. Second, you're going to use small, gentle, circular motions to sweep along that gum line. Third, be a completionist. Get all the surfaces, outside, inside, and the tops where you chew. And finally, number 4, you have to consciously go after the spots that everyone misses. The very back surface of your very last tooth and any areas where your teeth are a little crowded. So brushing is the foundation, no doubt. But for a lot of people, especially if you've got active gum disease, it's just not the whole story. We've got to talk about cleaning between the teeth. And here's a key visual cue for you to look for. If you go look in the mirror and you see these little gaps, sometimes called black triangles, down between your teeth near the gum line, that's a big sign. It means that space needs a totally different tool to get it clean. Okay, this is where a lot of people get tripped up. When do you use floss and when do you use something else? It's simple, really. Floss is perfect for tight contacts, when your teeth are right up against each other with no gaps. But if you have those black triangles we just talked about, then interdental brushes are non-negotiable. For active gum disease, these little brushes become your main weapon for cleaning out those spaces. All right, a few pro tips for using these. First off, size is everything. You'll probably need a few different sizes for the different gaps in your mouth. Second, don't just rely on the brand's color coding because it's not universal. Pay attention to the actual diameter of the brush. And finally, here's a great little trick. Bend the brush head just a little bit. It makes it so much easier to guide into the gap without poking your gums. All right, let's tackle a more advanced topic. If your dentist or hygienist has ever used the word pockets with you, we need to talk about how to clean those sneaky areas where bacteria love to hide out. So what in the world is a gum pocket? Well, think of it like this. It's a tiny gap that forms between the gum and the tooth when the gum has pulled away just a little bit. This creates the perfect little hiding spot for bad bacteria, and your normal toothbrush just can't get in there. This is really the front line in the battle against gum disease. And for this very specific problem, you need a very specific tool, the single tufted brush. It's kind of like a tiny, precision-tipped paintbrush for your teeth. Its design lets you gently trace the gum line of each individual tooth, and that little tuft of bristles can dip right down into the pocket to disrupt the bacteria that are hiding there. Now, there is a way to supercharge this whole cleaning routine, but this comes with a very, very important warning. This is something you should only do for short periods, and only if your dentist has specifically recommended it. The technique involves using a powerful antiseptic mouthwash, one with chlorhexidine. But, and this is key, you don't swish with it. Instead, you dip your interdental or single-tufted brush into it and apply it directly to the problem spot. This is for tackling really aggressive areas, not for everyday use. Okay, we're almost done, but I have to leave you with one final and kind of strange piece of information. It sounds weird, but it's absolutely true. As your gums get healthier, they can actually shrink. So here's the final question to noodle on. If you start using all these techniques and you suddenly notice new black triangles showing up between your teeth, is that a bad sign? You'd think so, right? But actually, it's often a huge sign of success. It means the inflammation and the swelling are finally going down. That puffy, diseased gum tissue is healing and tightening up against the tooth. So even though it might look like you're losing gum, what you're really seeing is a massive gain in health.